I want to thank Shevi as well and the entire Orthodox Jewish Nurses Association for inviting me, and thank you all for putting on such a wonderful program. I think it's incredibly important for Orthodox nurses to have a society and a place where they can give chizuk to each other in a very difficult time. I know that sometimes nurses feel left out alone, and I think it's very, very important to have an opportunity to professionally as well as socially gather together with your peers who are shomer Torah and mitzvos that can give each other chizuk and give each other support, as well as to make sure that you're at the cutting edge of things that you need to know from both a medical point of view, but also from a halachic point of view. And what I'll try to do today is basically go over very, very briefly, hit the Rashi Prokim, hit the highlights of a number of important things regarding vaccines. And I'm sure all of you are especially interested in the pediatric indication that now is available for the Pfizer vaccine between the 5 to 11-year-old population. It's already been approved for or authorized for the populations above that, the 12-year-olds and up, and give you reasons that you should encourage actively your children, in my case, grandchildren, to go and get vaccinated. Baruch Hashem, all of my grandchildren that are eligible, Baruch Hashem, have either gotten or are getting today, because it's a holiday, so their parents are off from work and able to go and get them vaccinated in the 5 to 11-year-old age group. So I'm not recommending that you do something that I don't strongly recommend for my own family, for my own self. And I'll try to explain to you why I feel this way. So let's first just remind everybody that COVID is not over. Can't hear me? Let's remind everybody that COVID is not over. Whatever hospital you work at, I'm sure there are active COVID cases right now. We had a from unvaccinated person die in our ICU last week. Not last year, not by Purim of 2 years ago. Last week, a from unvaccinated person died. Another from unvaccinated person in our community died the week before. I'm not talking about how many people are sick. I'm not talking about what's going on in the community in terms of transmission. I'm talking about death. I'm talking about from people who are still dying now, who are unvaccinated. And the single most important fact that I can tell you, that's indisputable, despite whatever nonsense you may read on social media and hear from your friends, is that almost all of the deaths in the United States right now from COVID and worldwide are in unvaccinated people. Don't let people tell you nonsense that, well, vaccinated people get COVID also, and therefore why should I bother to take this vaccine? It doesn't work. It's sheer nonsense. It's sheker. It's not true. The data, hard published data, which you can analyze yourself, as opposed to some of the stuff that's out there on social media, which is not fact-based, which is not evidence-based, which doesn't give you and quote you articles, chapters and verse from published material. But the published data clearly show that the unvaccinated people are the ones that are still dying from COVID. Yes, there have been rare vaccinated people who have died from COVID. Almost all of them have been severely immunocompromised people who probably, unfortunately, did not benefit from the vaccine. Their immune system did not allow their body to mount an effective immune response to the vaccine. And we now know that people who are severely immunocompromised, for example, a solid liver transplant recipient. So those people, if they do get COVID, may not have benefit from the vaccine. And as a result, those people should be vaccinated differently. We are recommending that those individuals get 3 shots right up front. Not this concept of waiting 6 months, but that those individuals get a vaccine at time 0, 1 month or so afterwards, depending on which vaccine they're getting, the Pfizer versus the Moderna, the 3 or 4 weeks, and then get their 3rd dose 1 month after that. And that has been shown in published data to boost the immune response of those individuals, about of which half did not get a good response, to give half of that group a good response. So you're dealing with a very at-risk population, and especially if they're older, and especially if they have other medical problems besides just their immunocompromised state from being a solid organ transplant recipient. But those individuals need to get more of the vaccine, and not that you should argue and say, well, the vaccine doesn't work. The vaccine works even in that group very well, but it doesn't work for all of them. And we're looking at right now a 4-dose regimen for that group of very high at-risk patients. So the only people who are vaccinated who unfortunately have passed away from the experience in Eretz Yisrael, we owe a tremendous debt of gratitude to the Public Health Ministry in Eretz Yisrael for their wonderful rollout of the Pfizer vaccination across Eretz Yisrael, and more important than that, the publication and the dissemination of the data so that we can protect ourselves here in Chutz La'aretz based upon the experience in Eretz Yisrael. And the experience in Eretz Yisrael shows that the vaccine, and this has now been subsequently shown as well in numerous publications, hard, actual, absolute evidence-based publications, to show that the vaccines are extremely effective in preventing serious illness and death, even beyond 6 months. Again, there's a misrepresentation of data out there that is either intentional or just ignorance, that says that the vaccines don't work beyond a certain point in time. And that's simply not true. They work great if you're using the endpoint of death, serious illness, ICU stay, intubation as your characteristic for does the vaccine work or not. Yes, there are breakthrough infections, mild, often even asymptomatic, that are picked up on routine screening, or mild illness that Baruch Hashem goes away. And yes, there are people who get even a little bit more severe illness. But the likelihood of being admitted to the hospital, of being admitted to an intensive care unit, having severe illness requiring intubation and Rahman al-Islam death, is probably 15 to 20-fold decreased if you've been vaccinated. That means that these vaccines are phenomenally effective. And the giving of the booster dose in Eretz Yisrael, and as well there's already published data from the United States as well as from Europe, clearly demonstrates that the booster doses will even further ameliorate that little bit of more severe illness and make it almost zero for death and serious illness. And the experience in Eretz Yisrael has been phenomenal in terms of demonstrating that those that receive the booster dose, and in Eretz Yisrael, it's all the Pfizer vaccine, but the data suggests same data would be applicable to the Moderna and to the J&J vaccine, and probably to the other vaccines that are available across the world, that serious illness is almost zero, not zero, but almost zero in those populations that have received a 3rd dose of the vaccine. I have received the 3rd dose of the vaccine as soon as I could get it. Again, I don't tell you to do something I don't recommend for myself and my own family. My wife has received the 3rd dose of the vaccine, and some of my children who are appropriate and eligible have received the 3rd dose of the vaccine. I strongly recommend for healthcare workers who are going into potentially contagious patient exposure every day, that at the appropriate time for yourself, you should get the 3rd dose of the vaccine. It will save lives. It will save lives, even with the technical difficulties. And I strongly do recommend it. Now, what is that recommendation based upon? It's based upon the published experience with patients getting the 3rd dose of the vaccine, not having significantly increased side effects versus those side effects which are common at the 2nd dose of the vaccine. 50% of the people don't feel well after they get the vaccine. After I had my first dose, I didn't have any symptom whatsoever after the vaccine. My second dose, I felt schwach for 24 hours. My third dose, I actually didn't feel as bad, felt schwach for 24 hours. The price to be a little bit schwach versus potentially dying from COVID, to me, it's halachically, as well as medically, it's a no-brainer. Well, what about all of those side effects? Well, let's talk about the side effects. You will see, unfortunately, people publishing lists of people that died from the COVID vaccine in our community. I do not know one person who died from COVID vaccine. I know a lot of people. I ask you, don't raise your hands. I ask you, do you know actually an individual that died from COVID vaccine? Because if you read the published stuff on the social media, they're dropping like flies every day. Now, I also ask you another question. Does anybody never know somebody that passed away unexpectedly before the COVID vaccine occurred? Never. I can relate too many shivas and too many levayas that I've had to go to for young people who died unexpectedly. No hidden substance abuse, no underlying medical problems that weren't publicized. People, Rahman al-Islam, that just suddenly died in their sleep who were young. I'm surprised that retroactively hasn't been attributed to the vaccine. Because everybody who's died since the vaccine has been out has been absolutely declared to have been dying from the vaccine. But that's basic statistics. And the people that publish that stuff never publish the statistics. And the statistics show what the incidence is of myocarditis in unvaccinated people who are young. The statistics show what is the likelihood of somebody, Rahman al-Islam, having a thrombotic event without having vaccination, without having COVID, and with having COVID, without having the vaccine. Those statistics are critical. Evidence-based medicine is critical to understand what is related to the vaccine and what is not. The different systems that are in place to detect rare side effects of the vaccine have been unbelievably successful in detecting them. The various cerebral thrombotic events that have occurred are occurring 1 in several 100,000, and yet they're picked up through these systems, multiple systems, to look actively to see what the side effects are. Do you know how many doses of the vaccine have been given so far in the world? Billions, probably well over 5 billion doses of vaccine have been given. And people say, well, it hasn't been tried on enough people yet. I'm going to hold back and wait a little bit. Maybe I could have understood that back in January of this year. I got my vaccine in December of the previous year, as soon as I could. I'm sure most of you, if not all of you, have been vaccinated, as you should. The vaccines have been tried now and tested for a long period of time in the studies. The studies were done before they were released to the public, and those patients are still being followed. Nothing has been described or identified other than the rare events that have been immediately published, immediately disseminated, and immediately looked at. I don't get any money from any pharmaceutical industry for giving this talk. I don't get any royalties if the vaccine is used for any vaccine. One of the most difficult for me to understand canards that's put out there is that all the doctors in the country are getting paid off to say what we get paid off to say. That's ridiculous. Whatever one might think of various pronouncements that have come out from various government agencies, the FDA or the CDC, in general, the overwhelming number of those people involved are erlicha, good people who have no hidden financial agenda that they're trying to bring forward. The Infectious Disease Society of America doesn't get paid off to say anything about vaccines. We don't get a penny. The Pediatric Infectious Disease Society, which just came out with the official full endorsement of giving the vaccine to children 5 to 11, gets no money from Pfizer to say that. It is, again, I think, a sign of our times. And Lauren Sota says it clearly, the end of the day, Be'ezus Hashem, B'yemos HaMashiach, chutzpah yazgi. Chutzpah, don't have to translate that, will be prevalent. To have people publicly state that basically every doctor in the country is on the dole, that none of us have an independent opinion, and none of us look at any of the hard published data and argue with it or debate it, is just, it's hiatus. It's just wrong. I find it very interesting, I said this many times, find one infectious disease physician in the country, I wouldn't even say the world, but I don't know enough about the world. But I know in the United States there is not one infectious disease doctor that is against vaccination. I've asked this on some of our listservs. I guarantee you, if any infectious disease doctor came out against vaccination, he would be the star of every single anti-vaccination event. The, quote, physicians, some of who've lost their license and are no longer physicians, that star at these types of events are never infectious disease physicians, never public health officials, never people with training in epidemiology. There is not one infectious disease physician in the country that disagrees with what I'm telling you. When you take your children, they get sick, to the doctor, you trust your doctor to know what they're doing. When they don't know, they call the pediatric infectious disease person. Why do they have a fever? And you follow blindly whatever they say. Take this antibiotic? Sure. Take this? Sure. Take this diagnostic? Sure. When it comes to the one area of medicine that there's zero controversy on, vaccination, all of a sudden, everybody questions it. It's ironic. HaKadosh Baruch Hu is having a good laugh at our expense. The one area for which there's no machlokas in medicine is the only area where there's machlokas. Doctors don't know what they're talking about. It's laughable if it wasn't so tragic. And that voice out there is unfortunately so strong. It influences people who are very knowledgeable, and it puts thoughts in their mind. That's why it says that when a dayan is supposed to go and judge a case, he's not allowed to listen to only one side. He has to hear both at the same time. When sometimes you see pronouncements coming out from Rabanim, and the last thing I'm going to ever do is publicly denounce or say anything about individuals. It's not my place. It's certainly not about Rabanim. But Rabanim only hear one side of the story. They're puzzled to paskin. And I know all of the Rabanim. I've had the schus of this pandemic to speak to many Gedolei Yisrael. And any Gadol Yisrael that I've spoken with, and have presented the facts to them, and they've had opportunity to hear from many other people as well. Certainly not the only opinion. But if a Gadol looks and investigates this, based upon Shulchan Aruch, you're obligated to listen to the majority of the mumchim. Now here it's not the majority of the mumchim, it's 100% of the mumchim that say that vaccination is highly effective. And I don't understand how any posek, any rav, could come out and say that it's also to get vaccinated, based upon what? There is not a single gadol who's published, not one gadol who's published that it's also to get vaccinated. From the earliest times when vaccination first became available, in the times of the Tiferes Yisrael, there's nobody around today who's on the stature of the Tiferes Yisrael, or the other great poskim of his time, or the poskim throughout our history. There's not one published gadol who says that vaccination is awesome. Not one. At best, you'll have gedolim, contemporary gedolim, great gedolim, who say, ask your doctor. I'm not going to paskin such a shayla. You have other gedolim, amongst them my great Rabbi Hershel Schachter Shlita, Rav Asher Weiss Shlita. I had the schus to speak with the Novominsker Rebbe Zatzal, a few weeks before he was nifted from COVID. And he said, this is the greatest potential illness for Klal Yisrael. He says you can't rely upon davening and learning Torah to protect you, because when shchicha hazeka, when you have a high likelihood of prevalence of something dangerous, you're not allowed to rely upon the Torah will be made. HaKadosh Baruch Hu will answer my tefillos. It's usher, this the Nova Minska. Zatzal, who had his levaya, which would have normally had hundreds of thousands of people. There was less than 1 million, because it was the heart of COVID, and he was a gadol b'Yisrael and said it's usher to attend my levaya because of the risk of contamination. It was pre-vaccine, it was pre our full understanding of transmission, and there wasn't 1 million in his levaya. That's a gadol b'Yisrael. And he said, we have to do what we have to do. Our Mordechai Willig Shlita feels it's an obligation, halachically, to get vaccinated. There's not one world-acknowledged Gadol Yisrael who's against vaccination. Harav Chaim Kanievsky Shlita, the Sar HaTorah, has publicly gone on record as saying you should get vaccinated, including pregnant women, including women. And talking about that, very important. It's a group, a majority of women. Talking about that, it's critically important to understand the facts about vaccination and fertility and other related issues. If Reb Chaim Kanievsky said that you can't do something on Shabbos anymore, you're not allowed to do this on Shabbos, the entire from Shomer Torah Mitzvahs world would stop doing whatever it was we were doing. If Reb Chaim Kanievsky said, don't do this. If Reb Chaim Kanievsky said, jump to shul on one leg, everybody would be jumping to shul on one leg. I don't mean that as a joke. If Reb Chaim Kanievsky says something, listen to it, except when it comes to vaccinations. Then all of a sudden, what does he know? His handlers, it's all fake, it's this, it's that. Unbelievable. Absolutely unbelievable. All the great Gedolim from all different tzutzos of Klal Yisrael. I hate to give labels. I like to call it Shomer Torah Mitzvos, or not yet Shomer Torah Mitzvos. So we're only dealing with the Shomer Torah Mitzvos camp. Branch of Shomer Torah Mitzvos you come from, the Gedolim of that tzutzos of Klal Yisrael strongly urge vaccination or al-machayev it. Rav Asher Weiss, Shlita, the posting for Shari Tzedek Hospital, all decisions in Eretz Yisrael passed by him. Professor Steinberg, Dr. Abraham Steinberg, arguably the most knowledgeable person about medical ethics. They've all written kuntrasim, they've all written published material advocating vaccination. And yet, I see all the time, well, my rabbi says it's awesome for me to take the vaccine. Did your rabbi do his homework? Did your rabbi look at the sugya? Did your rabbi speak to knowledgeable mumchim, or did he read something on the internet? Or did he get information from one side that's biased and incorrect? That's the only question I can ask. Because the Gedolei Yisrael who looked into this have all come out unanimously with either the recommendation to follow your doctor's advice, and all of the doctors who are mumchim say take the vaccine, or have even gone further and advocated taking the vaccine, or have gone further and said you're mechuyev, obligated to take the vaccine. There are almost no contraindications to the vaccine. Even people with severe allergic reactions have taken the vaccine under very supervised conditions. That's a separate shaila, won't get into right now. That shaila does come up. We've had one of our respiratory technicians who was highly allergic, but was at high risk and wanted to get vaccinated, and we were able to vaccinate her without a difficulty, even with her allergic history. So there are ways to even address those rare, potentially contraindicated individuals to the vaccine. Let's talk a little bit about the pediatric indication that just came out. So you should know, again, the Mumcha Society, who knows more about pediatric infectious diseases than the Pediatric Infectious Disease Society? They're the people that when Rahman was not, if you have a problem, you'd be running to them to help you out. You shouldn't need it. They endorsed 100% fully the recommendation to give children 5 to 11 years old the vaccine. Why? Because everybody knows that COVID is not a serious illness in young children, so why wouldn't we give a vaccine to prevent such illness? So let's look at the facts. Almost 1,000 children in the United States between the ages of 5 and 11, a little bit less than 1,000 children have died from COVID. That's 5 to 11 years old. It's the 8th most common cause of death in 5 to 11-year-olds. How's that for a doesn't hurt anybody illness? 8th most common cause of death. Well, but it's only in sick kids. Well, you're right in that sick children who have underlying medical problems are more likely, Rahman al-Islam, to run into trouble, but probably a third, maybe a quarter, unclear exactly, of those children that have died had no recognizable underlying medical problem. That means sometimes Rahman al-Islam, a perfectly healthy child, is going to die from COVID. Baruch Hashem, not a lot. What, is there a critical number that's okay and acceptable? We say Tillim, when a kid gets sick and needs an operation, it's one kid. Unbelievably important. Everyone in Chaya is important. What, we're going to dismiss several hundred children to die from COVID because it's a mild disease? But those are the objective facts, published facts. Go look at the CDC website. I'm not making this information up. Go look at the Pediatric Infectious Disease Society statement and see what the real facts are, not what some person who's being followed for no reason on the internet, other than maybe they're pretty or they have some other totally important reason that you should listen to their medical advice, is telling you that this is a mild disease in children. And of course, we don't know what's going to happen 20 years from now in all of those children that take the vaccine. Does anybody know what's going to happen 20 years from now to the children that get COVID? Long COVID is a real disease even in children. Is that going to impact their ability to learn a Tosfos? Is that going to impact their ability to be a wonderful Yiddish mother? We don't know. Long COVID is a real entity. Losing your taste or sense of smell for your entire life is a real, serious problem. Having impaired mental abilities, is that really what we want our children to be put at risk for? We have no idea. I don't want to scare anybody, but we don't know how COVID impacts children who are growing up, their brains are maturing, their body is maturing. But the vaccine, that's what everybody's concerned about. What impact is it going to have on the vaccine? 1 million children in the United States have already been vaccinated between 5 and 11. Now, we don't know what's going to happen to them. But in terms of short-term, acute-term side effects, nothing has been reported. From the published data, no expectation of anything serious. They're using a lower dose. Children in that age group, if they do get myocarditis, which has not been reported yet in that age group, it's a different entity, it's a different disease. And you should know that well over 90% of the people that got myocarditis in that slightly older age group, the adolescents and the young men, 20s, maybe up to 30, 35, it's been a very mild disease and it occurs very, very rarely. Does anybody know the incidence of myocarditis in that group in COVID? It's 6 times as high. Why aren't you worried that your child will get myocarditis from COVID? 6 times more likely than from the vaccine. That's not what you read on social media. What you read about is, I can't give my child these things because they're going to die from the vaccine. But they don't ever tell you that they could die from COVID. Far, far more likely. Rahman al-Islam. I hate to even say it. And finally, I want to address something that's near and dear to everyone's heart. Future progeny of Klal Yisrael. I have heard the most ridiculous comments. My wife works in Shadchanus. She works with YU Connects. Wonderful, wonderful organization. It's made over 500 shidduchim. And now they're beginning to have the question asked, which is up there with the importance of what color tablecloth do they use on Shabbos. We're now hearing the ridiculous question, are they vaccinated? I don't want to have a vaccinated girl. Rahman al-Litzman. My response to that is, I would never want such a person to be my son-in-law. These are true questions that shadchanim are getting, and that some mistaken Rabanim are telling their Talmidim, don't go out with a girl who's vaccinated. Now, what is this based upon? I defy anyone in this room or anyone outside this room to show me one paper even suggesting that there's a risk of infertility from the vaccine. I can show you lots of papers that show you that dead people don't have children. And how many young, from women have died from COVID and will never have children. Show me one paper, even a havamina, even a suggestion that COVID vaccination causes any impairment on fertility. Show me a paper. I'm open to read it. I don't have an agenda. If there was any indication that this could impact fertility, I would be the first person to tell you, don't take the vaccine. You have to weigh the odds. Only people in postmenopausal should consider the vaccine. Only men if that's the case. But now one paper, evidence-based medicine, not what somebody writes on the internet, not what somebody incorrectly states on the internet. That's not evidence. And again, I throw it out publicly. Show me the paper. There aren't any. I've looked. I can show you that pregnant women who get COVID, who are not vaccinated, die 15 times more likely than vaccinated women who get COVID. Death in a pregnant woman at childbirth is an almost unheard of event, except in the era of COVID, when we're again seeing maternal mortality that should almost never occur, and doesn't occur if they're vaccinated. Evidence-based medicine. This is a professional nursing organization. We should be following. Halacha demands that we follow the evidence. On Shabbos, if somebody has a chest pain in the shul, we call hatzalah. We don't start saying, well, it's probably indigestion, too much cholent last night. You're not allowed to say that. You're mechuyev to call hatzalah. If you have an expert cardiologist or a knowledgeable professional on the scene, he may or she may decide, no, I don't think we need to call hatzalah. These are decisions in Shulchan Aruch that go by the road mumche. You must follow the majority mumche opinion. It's clear in Shulchan Aruch. There's no man d'Omer that disagrees with that. There's not a rabbi who disagrees with that, except when it comes to vaccination. Then all of a sudden we throw Shulchan Aruch out. I'll conclude with the last halachic statement that I want to make. The very last siman in Shulchan Aruch, in Choshen Mishpat, teaches us that there is an obligation, a chiyuv, to remove obstacles to your good health. Kodesh Baruch Hu wants us to serve Him healthy. Kodesh Baruch Hu wants us to serve Him with our fullest abilities. You can't do that if you're sick. You can't do that if, Rahman al-Islam, you're dead. And that's the primary basis why we need to get vaccinated. Because the more people that are vaccinated, the less likely there will be transmission of disease, the less likely that there will be fatalities or serious illness. And the less likely there will be variant strains that will develop, like the Delta strain, that may be much more contagious and may be much more serious for Klal Yisrael and for the entire world. So I've tried to bring forward to you the most important information. There's so much other stuff that I'd be happy to try to answer. I've run out of the time that I've allotted to me to speak, but I left the time specifically for questions. There are new therapies coming along, in addition to the monoclonal antibodies, which are extremely important and very effective. there's a lot of data about the importance of vaccinating people who had COVID in the past, and that the vaccine provides enhanced immunity versus the, quote, natural immunity that COVID provides. And it does provide some immunity. Clearly, in the 3 months to maybe 6 months after COVID, a person gets COVID, they almost never will get a second episode of COVID. But beyond that, there are clearly reports. We've had patients in the hospital. I know many patients that have had a second episode of COVID. And the vaccine immunity is superior to the immunity generated, as published in 2 papers that are very impressive, good papers. So that's not the final answer. And natural immunity shouldn't be dismissed as being totally unimportant. And in fact, if somebody got vaccinated and then got COVID, I actually don't think they need a booster. I think they got the booster. It's called COVID. And there are different opinions about the optimal time to vaccinate, and that's a very technical discussion, which we don't know the complete answer to. But you should know that having had, quote, antibodies is not necessarily in any way protective, because we don't check for the right antibodies. The antibodies that you check are not neutralizing antibodies. There is no test available outside of a research laboratory to check for neutralizing antibodies. And even there, we're not sure what level of neutralizing antibody is necessary. And even there, it's not only antibodies, there's an entire other branch of the immune system that plays a critical role of whether you truly have immunity or you don't. So, I leave you with the following thought. Everybody in this room has dedicated their lives to helping other human beings. I beg people to help other human beings by getting vaccinated. That's a way that you can actually save lives, whether you're a physician, a nurse, or a healthcare professional. The more people that we get vaccinated, the Yezzus Hashem is the fastest way out of this pandemic. So I thank you very, very much for listening. I'll be very happy to address all of the questions that have been sent up here, and I'm just going to take them in the order that I have them.
I'm bringing up some more.
Oh, okay. So,
Do you want us to read through each other's stuff?
so why don't you do that? Read through some that are, either more prevalent, and I'll just start off at the top. Okay, this person wrote, as the first RN in my unit to proudly get vaccinated, Yashakayach, an honor and a privilege. But I am hesitant to vaccinate my 8 and 12-year-old children. Okay. This is very nice. This was before you started speaking, but now I'm no longer hesitant. So thank you very, very much. I'm reading this, as I said, I didn't pick this out, it was the top one. So again, I will tell you, Baruch Hashem, this week I've had many of my grandchildren between the ages of 5 and 11 either already vaccinated or getting vaccinated today. So I'm going to take questions only from the cards, please. It's not fair to the people that wrote them out. So I do think it's very important to do so. Discuss it with your pediatrician. Ask your pediatrician what you should do, as you should be doing most of your medical questions, and then do your own research if you still have doubts. Go and read the Pediatric Infectious Disease Society statement. That's the first place you should start. They go through the reasons why you should get vaccinated, why your children between that age group should get vaccinated, because of the seriousness of the illness, as Baruch Hashem, less serious it is compared to adults. We know that with COVID, every decade of life, I don't see anybody here in older decades of life, but when you hit the 70s, 80s, and 90s, COVID is a much more serious illness, 100%. When you hit 40, it becomes more serious than if you're 30. But it's serious even for babies. Baruch Hashem, much, much less serious from a statistical point of view. But not if you're that one person that gets COVID, gets long COVID, gets missed, the inflammatory heart condition associated with COVID, or gets any of the other complications that are associated with COVID. Next question, any data on amenorrhea with vaccination? So the answer to that is no. There is no data, which is a problem. And it's being looked at. There's a study underway right now specifically looking at that. People have to understand that irregularities in the menstrual cycle occur in almost all women at some point in their life. There are very, very few women that go like clockwork every 28, 30 days for their entire menstruating lifetime without any irregularities. So to blame an irregularity on the vaccine is not statistically sound, and that's why it needs to be looked at. But there is no published paper that I'm aware of, again, a scientific paper that does demonstrate either no effect on menstrual irregularities, or yes, an effect, and that's why it's being looked at. But anecdotally, in speaking with many OBGYNs, they have not noticed an increased incidence of such complaints in their full population. But again, that's not a scientific way of looking at things, and it needs to be looked at. Why do they recommend that people who had COVID and still have antibodies get vaccinated? So I addressed that a little bit. Number one, we don't know what antibodies mean. Anybody that tells you, oh, I have high antibodies and therefore I can't get COVID, should go look at all the people who've gotten COVID even though they have high antibodies. You can get a second episode of COVID. And anybody that doesn't agree with that, well, they're closing their eyes. That doesn't mean that it's not potentially beneficial. We just don't know what that means. And therefore, we can demonstrate, a published article in the Morbidity and Mortality Weekly Report back in July, which dealt with Delta infection, clearly showed that having had vaccine versus just having had COVID, having the vaccine was twice as protective as having had COVID against the Delta variant strain. So that's why even if you had COVID, and especially if you had COVID back in Purim Pesach when it first came out, the clear benefits of vaccination have been shown. That's not to say you won't get possibly some benefit if you don't get vaccinated. But again, the data support getting vaccinated. How are you confident in the vaccine when it first came out before any real studies were done? So the answer to that is that the real studies were done. They looked at it in 40,000 people who got the vaccine and 40,000 people who did not get the vaccine. And Kodesh Baruch was very kind to us. He let two separate companies with almost identical but not identical products do the same exact study in parallel with Moderna and Pfizer. Unrelated, no talking in between them, no wink, wink, let's publish the same incorrect data. And the data were identical, 94.5% and 95% efficacious. That's statistically identical. So when people say, oh, it hasn't been studied, it's been studied quite a bit before it was authorized. And if you looked at the data yourself, as opposed to letting somebody else tell you on social media what the data are, included in those side effects, people who died because they got hit by a truck. One of my favorite ones is that one patient actually got struck by lightning in the vaccine group, and that is considered a complication of the vaccine. When we look at this, because they look at all comers, they don't try to distinguish. So getting hit by lightning is a complication, according to the published studies, of getting the COVID vaccine. When you look at things through the prism of science and halacha, these were all appropriately tested, and you're dealing with a life-threatening illness. You don't have the luxury of waiting 10 years to see what will happen. A lot of the narishkeit out there says that it impacts your DNA, and it's going to change your whole body. So that's, again, shtus v'hevel. There's not a shred of evidence that it impacts your DNA. It can't. It doesn't work that way. If you know anything about mRNA, it doesn't change the DNA. It doesn't have anything to do with the DNA. It doesn't have anything to do with regular RNA. It's purely a messenger. That's why it's called messenger RNA. It just tells your body, make this protein, which is a spike protein, so your body will then make the immunity to that spike protein. And if you didn't like that, there was the J&J vaccine, which is a, quote, normal type of vaccine that we've had. Is it risk of asymptomatic disease transmission to a vaccinated adult almost zero? So I'm not sure I understand the question. The risk of asymptomatic disease transmission to a vaccinated adult almost zero. So that's not true, if I understand the question correctly. A person who is asymptomatic can be contagious. And yes, vaccinated people, Baruch Hashem, don't get it, but they can get it. That's the whole point of getting that third dose. And again, if the person who's vaccinated does get it, they do have the chance of getting sick. Baruch Hashem, most of them don't get very sick. And that's why we recommend the vaccination in that situation. Okay, good question. I didn't discuss this. After you receive the third dose of vaccine, what about a fourth dose of the vaccine? So at the present time, the only people that should be considered, and it's right now in a study setting as opposed to in a practical setting, but I would consider giving it to somebody who is severely immunocompromised and has not demonstrated any evidence of immunity after 3 doses. So if you had Rahman Islam, I sit on the New York State Transplant Council, and I know the data for the number of people who've been transplanted and then got COVID. So we saw an uptick in deaths, even after the vaccine, because many of those people did not get the full benefit from the vaccine. And that's part of the reason why we recommend that they get 3 doses right up front now, at 0, 1 month, and 2 months approximately. So those people who don't mount any immune response are being looked at in a study right now, should they get a 4th dose of the vaccine, and at what point they should get the 4th dose of the vaccine. So that's the only person at this point in time that I would even consider recommending a 4th dose of the vaccine. There is no reason at this point in time to think that we will or will not need to get annual booster doses of COVID. We don't know. Anybody that tells you, I think that you will, I think they won't, okay, they're entitled to their opinion. I'm entitled to my opinion. I won't tell it to you because I really don't know. So yeah, I will tell you there's a chance that we may need to get a 4th dose some point in the future. There's a chance we may not. So that's my opinion. We don't know. I like to say what we know. I like to say what we don't know. The famous Rashi in all the Gemara is when Rashi says, Lo yadati, I do not know. It says it 26 times. That's, my Rabbanim taught me, is the greatest Rashi. The ability to say, I don't know. Rashi could have left it out. Nobody would have known that Rashi didn't say comment. They said, no, Rashi didn't have anything to say on this. Rashi said, I don't know. It means there's something here, but I don't know what it is. That's the greatest Rashi. What difference exists from 5 to 11 than 12 and up? Oh, my 10 and 12-year-old are the same size? Why is it those so different? That's a very good question. So when you do public health, when you do dosing like this, it doesn't make any sense, and yet we do give the same exact dose to a 250-pound lineman and to a 80-pound soaking wet 90-year-old. We tend to give the same dose. That's because the studies were done on those doses and shown to be safe and effective. And yes, it would make sense to, as in pediatrics, they give a milligram per kilogram dose. As opposed to adults, everybody gets the same dose. So it makes more sense to give a milligram per kilogram dose, but that's not the way these studies were done. And therefore, we break the 2 groups into 2 separate sections. We give one, the 5 to 11-year-old, a third of the dose, and we give the adults, quote, 12 and up, the full dose. So we're giving 30 micrograms in 12 and up, and the 11-and-a-half-year-old gets 10 micrograms. Does that make perfectly good sense? No. Is it reasonable? Yes. And the big Shiloh that always comes up, I've been asked this already a number of times, there were 11 and 9/10 at the first dose, and there'll be 12 at the second dose. What should you do? So take them. You do whatever you want. I tell people, give the same dose they got the first time just to keep life easier. You want to give the 11 and 9/10-year-old kid the adult dose, perfectly fine. The difference between the 10 and the 30 microgram dose has not been shown to be clinically significant. You get, Baruch Hashem, wonderful immunity with both doses, and nobody's demonstrated, although the thought is, well, the kids, if they're so small, let's give them a smaller dose, they'll have less side effects. It hasn't been shown to be true, it makes sense. And that's what the tests were done on, that's what the studies were done, and therefore I think it's reasonable. If you have a very, very small 12-year-old, and you have a big stock 11-year-old, yeah, it would make sense that you give the 12-year-old a smaller dose and the 11-year-old the higher dose. So discuss it with your pediatrician. Why should we get a booster without first checking titers or antibody levels? So the reason for that is because when you tell me the antibody or titer level, I won't know what it means. I have not checked one antibody titer, including my own. I don't know any other doctor that didn't check their antibodies about 20 times after they got vaccinated. And the most common call I got after vaccines, this is a true story, it's so funny. It shows you that people don't think, even if they're doctors. They got the wrong test. They all ordered it to LabQuest or LabCorp or Quest or whatever they were getting their antibodies, and they had no antibody after the vaccine. They were running to me and telling me, what should I do? What should I do? It didn't work. I said, what test did you order? And they showed me they ordered the same test that you would if you had COVID, but not if you had vaccine. So they weren't checking for spike protein antibody, they're just checking for some other nucleocapsid, which of course they're not going to have if you got the vaccine. At least 50 doctors, at least, called me with that. So now they checked the right, quote, antibody. But it doesn't mean anything. I do not know. I get 5, 10 emails a day. This is my NLL, should I get a booster? I say, why did you check this? Ask the person who ordered the test what you should do, because I don't know what to do with it. I never recommend checking antibody levels. I never checked it on myself. I shouldn't say that. When I went to Eretz Yisrael, they forced me to get an antibody level. Baruch Hashem was very high. Meaningless. If that's the reason why they let me into Eretz Yisrael, I think the real reason was to see if I got vaccinated. Because I don't think they trust us, unfortunately. And unfortunately, we are the people of MS. Tikkun Emes Yaakov have been found in many situations to fraudulently produce PCRs that weren't really done, to fraudulently produce vaccine cards that weren't really vaccines. This is the Amma Torah. This is the Amma MS. I don't want to get vaccinated, but it's okay to lie. The Bar Sheker, Tirchok is only applicable to vaccines. It has nothing to do with anything else in life. We're allowed to lie, cheat, steal, do whatever we want, as long as we don't take the vaccine.
We have tons and tons of questions. Many of them are overlapping, but time is running short, so this is going to be probably Dr. Glatt's last question.
Many transplants patients cannot mount an immune response to vaccinations. Again, this person's father hasn't had antibodies after, I think, 4 vaccines, if it says. Can you discuss the benefits of Regeneron? Oh, great question. For prophylaxis. This is unknown, but very promising. Now, nobody should take away from what I'm saying now. You don't need to get vaccinated. Glad said go get a monoclonal antibody infusion, you'll be fine. That is totally incorrect. Except with the possibility of people that have been vaccinated and don't have any level of immunity that we can detect. And potentially, the giving of these various monoclonal antibody infusions may protect you from getting COVID for a significant period of time. It may impair your ability to also mount a good response to the vaccine, which is why we don't recommend that if you got the infusion that you get the vaccine booster for a period of at least 90 days, but possibly even more. There just was a study that came out that suggested that you may actually be unlikely to get COVID for a period of 7 or 8 months. So yes, in a study setting or under very rigorous conditions for a very specific patient, the potential for giving a monoclonal antibody infusion to give them passive immunity because they cannot generate active immunity from the vaccine is a reasonable thing to study, which is being studied, and a reasonable thing to consider for an individual patient who is extremely immunocompromised. Again, please do not quote me as saying that I think antibody infusions are new sliced bread and everybody should run out and get them to prevent COVID. There's a simple way to do that. Get vaccinated. Much more effective and much better, much cheaper, and I think less toxic. So I thank you very much for listening to my polemic. I am obviously very strongly advocating for vaccine, but that's only because I have seen too many people in my shul, too many people in my community, too many people in my hospital who never have died of COVID. And I haven't seen one person who's died from the vaccine. Thank you for listening. Have a wonderful day.